pressure. What are risk factors for heart disease? They're what I call changeable and unchangeable risk factors for heart disease. Here, let's have a look. Which ones in here would you consider unchangeable? The unchangeable ones would be genetics, male gender, and geez, did I not even put it here? Goodness, age. Those are factors that you can't change. You can't pick your parents. I'm not really clear on whether the male hormones, if somebody is having gender surgery, if that affects heart disease risk. But it certainly, as we saw at the beginning, that age is a risk factor for heart disease. So those are the unchangeable risk factors for heart disease. Then we have the changeable risk factors. So these are risk factors that hopefully you are able to help modify to reduce your risk. Those include lowering your serum or blood cholesterol, quit smoking, drinking alcohol. I know that a lot of people think that alcohol, particularly red wine, can help lower risk for heart disease, but I hate to tell you this, it doesn't look like that's actually as true as we want it to be. So I don't think that you can say you're drinking wine to help lower your risk for heart disease. It might be time to get honest about that. High blood pressure, diabetes, obesity, sedentary lifestyle, hopefully those are factors that you can work with to help improve so you can lower your risk for heart disease. Stress. This one makes me sad because I did have a student once say to me that they thought that stress was an unchangeable risk factor. And consuming a diet that's low in fiber and high in saturated fat. Those increase your risk for heart disease. You want to increase your dietary fiber and lower your saturated fat. Like we're about to say, how can you reduce your risk? Change your lifestyle, which is, of course, no easy feat. You need to have a lot of support. You need to have health insurance. So that may be the hardest one on this list. But changing lifestyle to include a healthy diet, regular exercise. Now, the guidelines will say an hour a day. I usually tell people a body in motion as opposed to a body at rest. So if you're not doing anything, please start moving. And if you are able to do any or all of these, they can help to reduce your risk, improve your blood lipid or blood fat values, and help reduce blood pressure levels. This is a graph showing the incidence of death from heart disease per 100,000 people and levels of cholesterol in the blood. I hope one of the things that you're thinking is that correlation doesn't prove causation, because that's true, and we'll talk about that in a second. About 50% of heart attacks occur in people who have normal blood cholesterol levels. But that's why it's important to know your family history. If you have a family history of people with heart disease and they had high cholesterol, perhaps lowering their blood cholesterol could have made a difference. We introduced these back at the beginning of the semester when we looked at the different types of fats in the blood, or blood lipids. We'd have what are called VLDL and chylomicrons. These are the lipoproteins, the proteins that transport fat that are highest in triglycerides. And then we have serum or blood cholesterol, the LDLs and the HDLs. This should, somewhere in the gray matter, trigger a little memory. We looked at this at the beginning of the semester. If you recall, the chylomicron is the first lipoprotein to leave the intestinal tract. So it's the one that most closely represents what you recently ate, which is why we ask folks to fast for maybe 8 to 12 hours before they have their blood drawn to check cholesterol levels. And also, please remember, lipoproteins are proteins that transport fat throughout the body. So we have the chylomicrons and the VLDLs that are highest in triglyceride. And then we have LDL and HDL that have varying amounts of protein and cholesterol. I tell people to remember H is healthy and L is lousy when you're looking at blood cholesterol levels. Elevated triglyceride levels can be associated with heart disease. They can cause the blood to thicken. This may cause a condition called hypertriglyceridemia. Hyper meaning high, triglyceride, EMIA in the blood. Hypertriglyceridemia, high blood triglyceride levels. Triglycerides are packaged in the lipoproteins called the chylomicrons and the VLDLs. When you have high triglyceride levels, really high triglyceride levels, that can make your blood really thick. Unfortunately, I can't show you the model that I have of how thick the blood looks at different triglyceride levels. But with really high triglycerides, it's kind of like ketchup. And triglycerides change as the lipoprotein moves from the intestinal tract throughout the bloodstream, which is why we ask people to fast for 12 hours in order to give us a more accurate idea of how your body processes triglyceride. If after 12 hours you still have a high triglyceride level, that can indicate a problem. Oh, here we go. I don't ask you to remember numbers, so please don't worry about that. Under 150 is considered normal. Over 450 is like pumping ketchup. And this thickened blood, as it flows through the arteries, is one of the things that can injure the arterial wall and then cause plaque buildup that can lead to heart disease and stroke. High cholesterol levels are associated with atherosclerosis if you have two other risk factors. We talked about how cholesterol is packaged into LDLs and HDLs. And as I said, LDLs, you should remember, are the lousy cholesterol. High LDLs are not a good thing. HDLs are the healthy cholesterol because HDLs tend to return cholesterol to the liver from the bloodstream, and that cholesterol is then used to synthesize bile, hormones, and certain vitamins. What the LDLs do is take the cholesterol that's being transported around the bloodstream and put it into the tissue. So LDLs can help increase the amount of plaque that lines the artery wall, thus increasing heart disease risk. This is cocktail chatter because I'm sure you want to share it with your friends, but these are the different levels for total cholesterol, for LDLs, and for HDLs. So if you ever have your cholesterol levels checked, this is something you might want to compare it to. If you look at it carefully, describes how inflammation can increase heart attack risk. If we look at the top, we have that clean, healthy artery. There's no plaque building up. And as we move down, there's an injury, arterial injury occurs. And that stimulates your immune system. It says there's something going on that's not supposed to be going on. And it results in inflammation. And that inflammation pulls LDLs into the blood vessel wall. It pulls cholesterol in, and you have the buildup of plaque, which, as we see at the bottom, is practically cutting off all blood flow. So this is how this inflammation that results from the injury to the artery wall can result in heart attack. C-reactive protein is a blood marker that shows that there's inflammation going on in the body. Problem with just looking at C-reactive protein is that you could have inflammation from an abscessed tooth. You don't necessarily know that it's inflammation that's happening inside the artery wall. There are other more sensitive tests that can detect that, but you need to talk to your doctor. It's also not sure how to treat high levels of C-reactive protein. This is an example of where we might have a diagnosis, but we don't know how to treat it. And I will put this link to this YouTube video. I will send it to you so that you can look at it. It's a short video that just shows how injury to the blood vessel wall attracts LDLs, it attracts white blood cells, it leads to plaque formation and heart attack risk. We're looking at cross sections of blood flowing through the artery. On top we have plaque that has kind of a small scab, if you will, on top of it. This is a blood vessel that has plaque buildup and has been injured, but the injury has healed and blood is flowing through the artery. But on the bottom, you see happening is an injury. For some reason, it could be high blood pressure, it could be high triglycerides, but that cap on top of this plaque is broken. This sends out signals to the immune system and the rest of the body that causes the formation of a clot. You have more cholesterol coming, you have more fat, protein, white blood cells, and a type of blood cell called a platelet that starts to build up to try to fix this injury. This is called thrombogenic. This is a thrombogenic activity. Thrombosis is clot formation, genesis of a clot. When the platelets have filled from the injury to the top of the artery wall, then blood flow ceases. Blood flow is cut off, and as we've said several times, if that blood is going to the heart or to an artery in the heart known as the coronary artery, that person will experience a heart attack. If that blood is flowing to the brain, if that blood flow is cut off, that person will experience an ischemic stroke.